Hey there, pleasure seekers. It's Amy and April from the Shameless Sex Podcast, and we're super excited to invite you to our upcoming retreat. If you're feeling a bit stuck in your pleasure journey, our Desert Retreat for All is the perfect excuse to prioritize you and maybe spice up your partnership too. Join us from May 8th to 11th in our luxurious desert villa near Palm Springs, California for a rejuvenating 4-day all-inclusive escape. And it's sponsored by Magic Wand, y'all.
We'll blend immersive pleasure workshops, poolside relaxation, and tons of fun activities in a safe, welcoming space. And just to be clear, this isn't a sex party or dating retreat, although we appreciate your adventurous vibe. It's all about discovering your unique pleasure blueprint without judgment. Whether you come solo, with a partner, or your besties, everyone is welcome in our pleasure paradise. Don't miss out on this life-changing experience. Head to shamelesssex.com and let your journey to shameless pleasure begin.
Hey listeners, DB here. We are excited to bring you a special feed drop from our friends at rePROs Fight Back, a podcast that unpacks the policies and politics shaping reproductive and sexual health, rights, and justice, right up our alley. This clip comes from an episode all about Medicaid, one of the most important but often overlooked programs in the fight for reproductive healthcare access that is currently facing devastating proposed cuts. Host Jenny Wetter sits down with Madeline Morcelle from the National Health Law Program to break down what Medicaid actually covers, why it's a lifeline for millions, and how proposed cuts could have devastating consequences to sexual and reproductive health. If you care about reproductive rights, healthcare access, or just want to know what's at stake in an easy-to-digest way, this conversation is a must-listen. And if you enjoy it, be sure to check out the full episode, plus more critical discussions by searching for rePROs Fight Back, that's rePROs Fight Back, wherever you get your podcasts.
Medicaid is our country's largest public health insurance program. Currently, over 72 million people with low incomes are enrolled in Medicaid's free or low-cost coverage. The program covers 1 in 5 people in the U.S., including 4 in 10 kids, over 8 in 10 kids in poverty, almost half of adults in poverty. And because of structural barriers to wealth, it covers a higher share of people of color and people with disabilities. It's worth noting some states have their own names for Medicaid. For example, when I was in grad school, I was covered by Mass Health, which is Massachusetts' Medicaid program. Wisconsin calls Medicaid Badger Care. Tennessee calls it TennCare. California calls it Medi-Cal, and so on. Medicaid is jointly financed by the federal government and the states, but administered by the states within broad federal rules. States are currently guaranteed federal matching funds called a Federal Medical Assistance Percentage, or FMAP, without any cap for qualified services provided to eligible enrollees. States receive a base FMAP and then enhanced FMAPs for certain populations and services. For example, under the ACA, the federal government picks up 90% of the cost of covering Medicaid expansion enrollees. Medicaid covers a broad range of services, including preventive services, prescription drugs, outpatient and inpatient care, long-term care. It's actually the leading payer of long-term care services in the U.S., disability services, and much more. Coverage facilitates access to care, improves health outcomes, lowers the risk of premature mortality, narrows health inequities, and provides financial protection from medical debt. And it's worth noting that Medicaid is popular. In recent nationally representative polling from KFF, more than 3/4 of the public supported Medicaid, including 6 in 10 Republicans and at least 8 in 10 independents and Democrats. Both Trump and Harris voters want policymakers to focus on improving Medicaid instead of cutting it. And among those enrolled in Medicaid, both Trump and Harris voters value their Medicaid coverage and the access to health services and medications for themselves and their children that it provides. They also value Medicaid because it helps protect them from financial disaster, alleviates stress, improves health outcomes, and often supports their ability to work. People say that losing Medicaid would be devastating and lead to serious consequences for their physical and mental health and exacerbate pre-existing financial challenges.
There are so many things that Medicaid covers, and I think people really think of like broader healthcare, but Medicaid is actually also a really big sexual and reproductive health program. Do we want to talk about some of the ways that Medicaid is covering things to do with sexual and reproductive health?
Yeah, so Medicaid plays an essential role in the struggle for equitable sexual and reproductive health care access for people with low incomes and many underserved communities, including Black, Indigenous, and other people of color, people with disabilities, women and LGBTQI+ people with limited English proficiency, and young people. States are required to cover family planning services and supplies, pregnancy-related care, and abortions within the Hyde Amendment's exceptions under Medicaid. Medicaid also includes a number of special protections to ensure that people can access family planning services and supplies, such as giving people freedom of choice to visit any Medicaid provider and to obtain those services, and also providing states with an enhanced FMAP rate for those services, which gives states a strong incentive to provide these services. Medicaid also allows states to provide family planning services and supplies to many individuals who are not otherwise eligible to receive Medicaid coverage. That limited scope Medicaid coverage is especially important in states that have not yet expanded Medicaid. And in addition to family planning services, all states provide access to life-saving breast and cervical cancer treatment via Medicaid, and many programs cover aspects of gender-affirming care. Some are starting to cover fertility preservation services, and Medicaid also covers critical preventive and treatment services for HIV in every state. In practical terms, Medicaid covers more than 40% of U.S. births and 65% of Black women's births. Medicaid expansion has lowered maternal mortality and narrowed racial maternal health inequities. It's the leading source of family planning coverage in the United States. It covers 40% of non-elderly adults with HIV. It has been critical in the fight to end the HIV epidemic, and its critical sexual and reproductive health coverage makes it a strategic target for those who wish to restrict access for millions across the country.
I love how much I think I know about all these things, but every time I get to talk to an expert, I always learn new nuggets of things that Medicaid covers or people that are impacted by its programs. It is amazing how many people are benefiting from these services and what a big role it plays in combating the really high maternal mortality rate in this country.
Yeah, absolutely. It plays a crucial role in ending the epidemic. And as I noted, states that have expanded Medicaid have witnessed reduced maternal mortality and lowered inequities across racial lines. So really profound effects for reproductive health equity.
I was really amazed last year for our 50-state report card. We started to measure, we added on the maternal health expansion where they could expand coverage postpartum for 1 year. And I expected to see variation. I expected to see a bunch of states deciding not to do it in other parts of Medicaid. And I was shocked this year as we're getting ready for the report card to come out next week. There are only 2 states that have not expanded. And first of all, I have to say, shame on Wisconsin. I am from Wisconsin. Come on, y'all. But it was amazing to me that there were only 2 states.
Yeah, the uptake of the American Rescue Plan Act's state plan option to extend Medicaid coverage after pregnancy from the statutorily required roughly 60 days after pregnancy ends to a full year after pregnancy ends has been spectacular. It's been wonderful to see almost every state adopt the option in a short number of years, including states like Mississippi and other states that have not yet expanded Medicaid. And those reforms, unfortunately, are that uptake of that optional expansion and extension of coverage is unfortunately now on the line as Congress faces the prospect of severe cuts to the program.